As the coronavirus threat looms large over the world, tanking not just businesses and whole economies across the globe, but also disrupting our daily lives, a lot has been said about following a number of simple measures to minimize COVID-19's impact. Among these measures, one basic rule that health professionals have stressed the most has been to maintain hygiene and avoid touching your face as much as possible. Yet, even as we are strictly advised against doing so, a companion of ours, one that lives in our palms and pockets and also comes quite frequently in contact with our faces, has managed to go under the radar and become an actual health hazard in these strange times of the coronavirus. While we have been focusing on sanitizing and washing our hands countless times a day, most of us have all but forgotten the smartphone, which in many ways is an actual petri dish for hundreds of viruses, including COVID-19, and comes in frequent contact with our palms and faces for not only making and receiving calls but also responding to messages and emails. In fact, a study conducted by the research firm DeSC found that, in a group of 94 people, the average person touched their phone over 2,600 times per day, petri dish for germs and viruses. While a little alarmist, it may not be completely wrong to say that your phone is in all likelihood one of the biggest threats to you in these times when COVID-19 is running rampant across the globe. As per the Seattle Times, an average phone is covered in germs, 25,127 bacteria per square inch, to be precise. While the number may look bad, a quick look at other reports which explain how your smartphone houses more bacteria than your average toilet seat just goes on to highlight how grave a threat the innocuous smartphone can be in these strange times we're living in today. But if you're still not concerned, then sample this report by the Quartz, which cites experts on the subject who claim the virus can live on your smartphone's screen for up to 96 hours and thereby pose a risk to not just your health, but even spread onto any surface it touches in the duration of its existence on your smartphone's screen. How can you clean your phone? But fret not if you find yourself feeling uncomfortable and visibly scared while reading this on the screen of your smartphone. There are a number of steps you can take to ensure that your smartphone is COVID-19 free, just like your sanitized hands. According to the Journal of Hospital Infection, the novel coronavirus can be efficiently inactivated by surface disinfection procedures with 6,271% ethanol, 0.5% hydrogen peroxide or 0.1% sodium hypochlorite within 1 minute. In simpler words, your phone's display can be disinfected using an alcohol-based solution. However, there's a slight catch here. Alcohol is not good for your phone's display. Or at least not all panels. This is because rubbing your phone with alcohol or other harsh chemicals can quite easily damage your phone's outer coating that's in place to protect it from fingerprints and smudges. Case in point Apple, which suggests that any of its products can be cleaned with 70% isopropyl alcohol. It has also recommended Clorox wipes to clean the phones. However, it does advise caution while doing so. The company has urged users to not expose their phone's display to anything abrasive, for example, soap. It has also urged users to not excessively wipe their displays to avoid causing damage to the screen or finish. Another option for day-to-day cleaning is investing in a UV light. This method is claimed to kill 99.99% of germs and bacteria. However, there's no official word on whether UV light kills this particular strain of the coronavirus. Mind what you touch. Clean that screen. The novel coronavirus can likely live up to 96 hours on phone screens. Most cases of COVID-19 are mild, but it travels quickly. Luckily, the best way to prevent spreading it is pretty simple: keep good hygiene. Scrub your hands for at least 20 seconds frequently, cover your nose and mouth when you cough, and try to avoid contact with others you know are sick. These techniques work because tiny droplets from coughing and sneezing can carry the novel coronavirus as far as 3 to 6 feet, or 1 to 2 meters. If they happen to make it into another person's airways, they could become infected. But the virus can also likely live on the surfaces these droplets touch, sometimes for multiple days, says Rudra Channapanavar, an immunologist who has studied coronaviruses at the University of Tennessee Health Science Center. Glass in particular, like the kind on screen of the smartphone you're probably reading this on, can harbor live coronaviruses for up to 96 hours, or 4 days at room temperature. These estimates come from data collected during the 2003 SARS outbreak and reported to the World Health Organization. The two viruses are genetic cousins, both infect our airways, have a single strand of genetic material, called RNA, and have proteins protruding from their shells. The virus behind the SARS outbreak is technically named SARS-CoV. The new virus is SARS-CoV-2. In theory, it'd be pretty easy to pick up the novel coronavirus from your phone screen. If someone coughed or sneezed near your phone on your morning commute while you were scrolling through social media, you could inadvertently touch that droplet and then touch your nose or mouth. Most people touch their phones and faces a lot. One study conducted by the research firm DeSC found that, in a group of 94, the average person picked up their phone 2,600 times per day. They also spent extended time on it, scrolling, checking emails, 76 times per day. Another small study from researchers at the University of New South Wales in Australia found that people touch their face about 23 times per hour, or 368 times during their waking hours. This study only tracked 26 college students, but still, it's a pretty common habit most of us do without thinking. Gross phone screens and other surfaces are nothing new. We're constantly exposed to viruses and bacteria on everything, and for the most part they don't make us sick. But it's worth remembering where these pesky microbes can live, particularly in times when infections are common. Chanapanavar says that if there's ever a time when you pick up an infection like COVID-19 without any known exposure to it, it's likely that you got it from one of these surfaces. Thankfully, there's an easy solution: clean the surfaces around you. Apple recommends cleaning phone surfaces with a microfiber cloth slightly damp with soapy water. You can also use face wipes or baby wipes, or a solution of half water and half rubbing alcohol. Just avoid any openings. UV lights will also kill most viruses, bacteria on surfaces, but those cost about $60.